what is the aim of this course on renal stones in practice?
The aim of the course is essentially educational. And because we want, our aim is to train a couple of specialists in the treatment of stones, one urologist and one nephrologist, in the treatment of renal stones in all its aspects, not only on the endourological treatment, on the urological treatment, but also for the metaphylaxis, that is the prevention of further episodes of stones. And also to train people, to train specialists in the prevention of the complication of renal stones, for instance, the problems of renal failure and the problem of the metabolic bone disease, and also the cardiovascular issues, which are very important in patients with renal stones. And we are very surprised that over the years the number of people interested on the prevention of these problems, not only on the treatment of that particular stone with urological surgery, but the prevention of further stones and the diagnosis, the metabolic diagnosis, is an orphan issue for the training of many specialists. But this is a disease that has some very important fallout in terms of economical, of the budget, of the health systems in each country, and for the patients, because he or she loses work days and he spent money for the treatment and so on. So, and furthermore, the risk for the body, not only the kidney, it is not just a question of pain, it is a question of the risk of losing the kidney, of fractures and systemic complications of the disorder.
And why is it so important to train nephrologists on the treatment of renal stones?
It is exactly because the nephrologists generally are not trained in the treatment, in the prevention, in the metaphylaxis of renal stones. And it is a topic that is not addressed generally during their training, during their fellowships. And on the other hand, we need to have people capable to do this job. And in many hospitals there is nobody with this training. And so we want to favor the cooperation between the urologist and the nephrologist. And when we thought how to plan this course, we reasoned that perhaps to favor this process of cooperation in many hospitals, a tool could have been to participate a couple of specialists, a urologist and nephrologist from the same hospital in the course, and because this can favor the cooperation in the hospital after the course for the treatment of all the aspects of the disease. Not only, generally the patients with renal stones are treated, they solve the problem, the acute problem, but then they are lost at follow-up and they are not anymore followed in terms of metabolic diagnosis and prevention of the stone.
And where are the speakers come from, and who are the students?
The speakers, the faculty is an international faculty. We have many speakers coming from North and South America, from Europe, and from Italy as well. The faculty is approximately 30 people, and it is really an international faculty, probably the best faculty, the most authoritative investigators in the world in this issue, in this disease. And in reference to the fellows, they come from 24 European and Mediterranean countries. We have people from Israel and people from UK and people from Poland and from Tunisia. So we are the fellows are also international. And this is because, as a second aim of the course is to establish a network of people interested in the treatment of stones, and this could be helpful not only for treating better people, but also for making research. By sharing common tools, sharing common methodology, could be very helpful. And furthermore, these people may recognize in the faculty some people who can help for further improvement of their own activity in their hospital in Tunisia or in Romania. This is the aim. I'm very grateful to Fondazione Menarini because this is an experiment we are doing, an attempt to improve the education of specialists on this particular topic, which is an orphan topic. So I hope that the experiments will be successful, and we are doing all our best for this goal. And because if it will be successful, it will be also a model to be copied in the future for the other meetings, for the other courses, and to improve the education of the specialists, the education of the professionals, but also for the health of our patients.